There are three features of the WebAcute status board that I would like to highlight in Expanse 2.2. The first is that you will notice at the top of the screen, each of the columns now shows the name or heading name for that particular column. If you prefer to not have the heading column names be displayed, you can hide them by selecting the icon with the up arrow that you see right here. Clicking that will collapse and hide the heading column names. The next feature I would like to show you is the ability to sort your tracker based upon which column header you select. Here, if I select, for example, the age column, I can select that and now sort my patient list based upon the patient's age. If I select it again, it will then sort the patient list in the opposite order. Similarly, if I want to sort my patient list by length of stay, selecting that column header will now display my patient list based upon the length of stay in ascending order. Another feature of the patient list tracker is the additional patient information box. You will notice here that on this patient, Betty PA, if I select this little arrow icon that you see right here, it'll open up a drop-down area of additional pertinent information for this patient. This includes such things as the family provider, allergies for that patient, emergency contact information, microbiology cultures that are positive, as well as the problem list and the patient's weight. You can roll this box of information back up by selecting the arrow once again. And the last feature I would like to highlight in Expanse 2.2 is this column here, the New Results column. You recall in Expanse 2.1, the activity log indicators that you see right here on the far right-hand side of the column would let you know when new results were posted to the system. Here, for this patient, Betty PA, we see that the lab is highlighted in red. We know that there is new lab reports back on this patient. In Expanse 2.2, now with this New Results column, I can see that the components of the lab that are positive are the blood gas, which is shown in red for critical results, chemistry in yellow for abnormal results, and microbiology in red for a positive microbiology specimen. Clicking on the new results that are shown here under the New Results column, it will take me into the patient's chart to review the results that are posted in the system. It is very important to note that when I click on this indicator, it will clear these items until which time is a new report is posted to the system. The system will assume that you will go in and look at all components of the diagnostics that have come back. You cannot go, for example, and just look at chemistry and come back and that the blood gas or microbiology will stay lit up as you see here. If you click on this column, all three indicators will go off when you go in to go look at the results. So let's go ahead and click on the new results that we see here. When I click on it, it's going to bring me into the patient's chart directly into the diagnostics section. Here, I can review the positive stool culture, the abnormal blood gas, and the abnormal chemistry. When I return to my tracker, you will now notice that the indicators have turned off over here in this column. It will not be until new results are posted to the lab that this indicator will show up again. When you go into your workload, for example for this patient that I select here, you're going to notice now over here on the right-hand side of the screen tabs related to the patient's chart. These tabs allow you to access information in the patient's chart while still working within your workload area. For example, for this consult request, I can go into visits and look at the most recent past 3 visits and review the documentation for that particular visit. This allows you to review pertinent information for the patient while not having to leave the workload area. Occasionally, after admission orders are done and the medications and home medications have been reconciled, It is discovered through a review of the medications, often by pharmacy, that a home medication was entered incorrectly on the admission process or the reconciliation process. If the medication on the patient's home medication list is changed after it is already a current order, the system is now going to prompt the user who has changed that home medication that the physician provider needs to be made aware of this change. For example, if I am the pharmacist or the nurse who goes into the patient's home medications, or if the physician were to go into the patient's home medication list, and I make a change to one of the medications, for example, the Ramipril 5 milligram capsule, it's currently at 5 milligrams daily is the dose that is listed here. When the pharmacist or nurse or physician provider makes a change to the home medication in the home medication list, it is going to prompt the user that this change in the patient's home medication list will need to be addressed in the current orders. If I select here Ramipril 5 milligrams, and this is what was on the initial best possible medication history that was reconciled, and I change that to 10 milligrams, and I save that, you will see that this warning comes up that tells the user that the medication was ordered at 5 milligrams, which was on the patient's initial medication reconciliation that was done on admission. And now that you've changed it due to updated information on the patient's home medication list, that the provider needs to be notified to make this adjustment to the active medications so as that it reflects this change in the appropriate home medication dose. Now, when the physician or provider goes into their current order list, they are going to see under the home medication here, Ramipril, the little picture of the house icon with a yellow exclamation mark. This lets you know that a change has been made to this home medication based upon the patient's home medication list that is now different than what is the actively ordered dose or frequency for this particular home medication as ordered. If you select this icon, it's going to bring up what that change is. It's going to show you that the dose has been changed from 5 milligrams to 10 milligrams. What you need to do at this point is select that you have reviewed that this change is now acknowledged in the patient's home medication list, and you now need to make that change to the current orders. I'm going to go ahead and select that I've reviewed this change, and I'm going to go ahead and change this dose from 5 milligrams now to 10 milligrams. I'm provided with the transition to new schedule summary, so I'm going to stop the dose of 5 milligrams that was ordered previously based upon the home medication list at that time, and now start the new dosing tomorrow of the 10 milligrams a day dosing. I'm going to hit save, and then I will go ahead and submit that order, which will now update the patient's current medications so that the home medication here, the Ramipril, is now at the 10 milligrams, which is the appropriate dosing based on their home medication list. Documentation in Expanse 2.2 has a few new enhancements. If I jump into the documentation section for this patient by selecting Document at the top of the screen, and selecting a documentation template such as the Internal Medicine Consult, you will notice that the look and feel of the documentation area is a little bit different. There are two modes for documentation in Expanse 2.2. They're referred to as Review and Refine mode and Rapid Entry mode. The default that you go into when you first open a documentation template is the Review and Refine mode. This is what you see here. This is pretty much typical of what you have been used to seeing in Expanse 2.1. The Review and Refine mode is best for documenting without using discrete data items or clickbox type documentation, as this provides you less scrolling and a cleaner, more readable editor to work within when doing your documentation. The Rapid Entry mode is best used when you're documenting using discrete data items, such as the checkbox type documentation. For example, under procedures, if I wanted to document a procedure for an abscess, here I can go through and document based upon these clinical queries by selecting them as you see here. I can jump and toggle back and forth between review and refine mode and the rapid entry mode. Here we're back once again in the review and refine mode. In Expanse 2.2, if you want to preview your document, there is a button now at the top of the screen, which you see here. Selecting that will show you a preview of what the report will look like in its final form. The menu button for activities such as deleting or canceling the document is now located over here on the left-hand side of the screen, with this icon here referred to as the hamburger button. Selecting that will bring up the menu where you can go ahead and cancel or delete your document. One of the biggest changes in documentation in Expanse 2.2 is how documentation is done in the Assessment and Plan section. If you document your assessment and plan in narrative format, this should be done in the narrative box that you see here. Documentation in the assessment and plan now requires that you select a problem from the problem list or the past medical history list in order to start documenting against that particular problem. Best practice is to use the assessment and plan section utilizing the problem list and the past medical history sections. Using the assessment and plan section will allow you to document your daily progress notes quicker and provide a means of reviewing previous assessment and plans all from one screen. Furthermore, using the assessment and plan section can be used to pre-populate your discharge summary. When you go into the assessment and plan section of the documentation template, you need to select a problem first. If you do some documentation within this consolidated plan box that you see here, it is going to require you to add a problem when you attempt to sign your document. It is recommended that you add a problem first before doing any documentation in this section. For example, we'll go ahead and add a problem for our patient. This patient was admitted with pneumonia. I'm going to go ahead and add that to my document as that is one of the main active problems that the patient is here with. The patient as well also has high blood sugars due to her type 2 diabetes. I'm going to add this to my active problem list as well. And I'm going to add that to my document. This patient also has a urinary tract infection. I want to add that as well to the active problem list. Since the urinary tract infection is not one of the patient's past medical history issues, I need to find that problem here by searching for it in the new problem box that you see here. I can do that by starting to type in the name of the problem, and it'll bring up a list of problems for me to choose from. You can see here that I have urinary tract infection with a yellow star beside it. This is because I have made this one of my favorites for problems to easily select for patients. I could have found this as well by selecting the star that you see here and pulling up a list of my favorite problems in alphabetical order, and I can go down here and select urinary tract infection, select active, and add that to my active problem list. I can now hit save, and this will add these 3 active problems to my assessment and plan section. Now that I have my problems listed, I can go ahead and start documenting my plans for these problems. By selecting problem number 1 here, pneumonia, I can go in and document my plan. This patient is currently on antibiotics, and nasal oxygen at 2 liters a minute period. We are going to monitor the patient closely, and reassess the oxygen requirement tomorrow period. Once I've done that and I want to start documenting on problem number 2, I select problem number 2 and I can start doing the documentation here as well. Patient's blood sugars have been running quite high period. We're going to go ahead and start a sliding scale of insulin period. And lastly, when I go into my third problem, the urinary tract infection, patient is currently on macrobid period we are going to send the urine off for culture period. We will reassess once the culture results are available period. Now that I've done my documentation for my 3 problems, I'm going to go ahead and save the document. Now, when we go to do future documentation, such as a progress note the next day, when I pull up the progress note template, or any template with the assessment and plan section, I can go into the assessment and plan and select the button here called View Previous. When you select this, it is going to bring up the previous problems from documentation that has already been done. I can scroll through the documentation here from the various physician providers who have done documentation on this patient and review their assessment and plans as well. Here I'm going to select the consult note that I have done just previous to this, and here you see our problems of pneumonia, diabetes, and urinary tract infections, as well as what our plan for that is over here on the right-hand side. I can decide what problems and what part of the plans I want to bring into today's progress note. Once again, I could pull that up from other notes from other providers by going into this section as well and selecting which particular note I want to look at that assessment and plan. If I want to just bring over the pneumonia, I can deselect diabetes and urinary tract infection and hit Apply. This will now bring the pneumonia over to my assessment and plan section and carry over the information from the previous note. When you're working with medical students and residents, if the workflow is that you're going to have your medical student or your resident add you as a co-signer to documents so that you will have the opportunity to review the document and sign off on it, this is going to show up in your sign queue that you see up here on the top of your screen under the Sign button. This would be the same workflow that we use in Expanse 2.1. However, in Expanse 2.2, when you pull up the document to co-sign it, such as you see here, this patient here, I'm going to bring up, this is a co-sign in my box for me to sign off on the document that my resident or medical student had been working on. Here's the note. I'm going to select the Edit button here. And when the document comes up, you will notice that under the narrative section that you see on the screen here, it has pulled forward the documentation from the learner into this particular section of my note. I have the opportunity to go ahead and use the documentation that the learner has done and either correct or change information in here, such as the time of symptoms was 5 days rather than 3 days. And then I can continue on and add more of my documentation here. This will allow you to use the information that the learner has already documented, add to it, edit it, and continue on with your own documentation to complete the note. When you do this, when you look at the preview of how the document will look, it is going to show the documentation from the resident or medical student, as well as the documentation that you have done, which repeats their documentation, but notes the changes that you have made to it, as well as the addition of your own information. If you, however, prefer to not bring forward the information from the medical student or the resident, you can select this menu button here called the hamburger button and select Clear Responses. This will remove all the responses in this particular section of the History of Present Illness section from the learner, and then you have an empty narrative box to put your own note in. You can then document your note in here, and when you look at the preview, you will notice that now it will show the resident's documentation or the medical student's documentation at the top, and then your documentation in that same section here at the bottom. It will clearly show who has documented what in the chart. Similarly, if I go into the Assessment and Plan section, I will see the documentation that is pulled forward from the medical learner, and I can once again continue on with this documentation here, or I can clear the responses from the learner and continue on with my own documentation of the note. And once again, this will clearly show in the final report what documentation was done by the medical student or resident and what documentation was done by the learner. When you're working with a learner, such as a resident or medical student, you also have the ability to edit their document right from the Provider Notes section by selecting their note that you see here. You do not have to wait for them to add you as a co-signer to the document and it to go to your sign queue before you have the opportunity to edit the document. This is done a lot in such areas as the emergency department, where the document is usually not signed until which time as the patient is discharged or admitted. This can be done anywhere, however, by just selecting the document and selecting the Edit button at the top of the screen, which you see here. As soon as you do that, it is going to add you as a co-signer to the document and then allows you to go ahead and edit the document as you would if it were to have shown up in your sign queue. I'm going to demonstrate some changes that have occurred with how you order series labs. For example, if you wanted to order a troponin Q8H times 3, I'm going to go into the order box and order a troponin. And here I'm going to select an urgent troponin. And I want this to be done Q8H times 3. If I select the urgent, I can type in the box here that I want to do this Q8H. So I'm going to look up Q8H and select that. Now, if I were to go to select another frequency for how often I want this series of labs done, you will see that the Q8H is going to be one that will be in this box as ones that I've used before. So I will not have to go up and look up all the directions each and every time. It's set here that I want to do this timed series order Q8H times 2. If I want to change that to times 3, or whatever number I want to switch that to, I can do that here. Now I'm going to get Q8H times 3. What is very important is that now you have to switch this series priority to timed. In order for this to be correctly ordered and correctly done, you must switch this series priority to timed when you're ordering series blood work. I can then go ahead and submit, enter my PIN, and this will now be processed. For those providers who are working in the emergency department, you're going to notice a couple new changes to the tracker as well. The first is similar to in WebAcute. You will notice the name of each of the columns shown in the header here. If you would like to sort your patient list based upon one of these column headers, you can do so by clicking that particular column. For example, if I want to sort my patient list by the elapsed time that the patient's been here, I can select that column and it will then sort my patient list based upon that criteria. If I wanted to sort by triage level, similarly, I can select that header name and it will now sort my patient list by that criteria. If you do not want to have this header shown on your list, you can hide the header by selecting the little down arrow here and select Hide Column Headers. The second addition to the tracker is the additional patient information box. If you select the little arrow that you see here, it's going to open up a drop-down box of additional pertinent patient information. This includes such items as the patient's family physician, their allergies, It will include their weight if it's on the file, emergency contact information, and current orders and patient problem list. You can close this additional information box by selecting the arrow once again. And lastly, if you select and click on the patient's ED length of stay time, it's going to show you the total ED length of stay, the physician initial assessment time based upon when you signed up to the patient, and what that total provider clinical time is, which takes into account how long the patient has been waiting to be seen and when you actually signed up to see the patient.